As the pandemic worsens in the U.S., the country has also fallen short of its target for vaccinations. That's led to debate on whether to change how they're distributed. For more insight, let's bring in Dr. Georges Benjamin. He's the Executive Director of the American Public Health Association here in Washington. Doctor, I wanted to ask you first, Joe Biden is pledging to speed up the rollout of the vaccine. Your thoughts on his plan?
No, I think his plan is absolutely amazing. As you know, he's going to move that vaccine that the federal government has in reserve and distribute that so we can actually get those shots into the arms. They're also going to scale up a federal effort to do mass vaccinations, which I think is very important. And then finally, continuing to emphasize the importance of wearing a mask, washing your hands, and keeping your distance so that we can promote prevention is going to be very important to try to contain this disease.
And we should clarify, there's supposed to be the first dose and a second dose, according to the science, according to the doctors, roughly 3 or 4 weeks apart, depending on which vaccine you're getting. The suggestion here is not to delay the second dose, is it? The advisory committee, the COVID-19 panel, seems to believe that they will catch up with the supply. Is that correct?
That's absolutely correct. They're not changing the vaccine delivery schedule at all. And what's happened is it's created some hoarding behavior. And so we want to stop that. But if we can just guarantee the good supply line, and the Biden administration is working hard to work with the companies to ensure the supply line so that we can clearly make sure that everybody gets their second dose on time.
So why was there this supply obstacle? One of the things that the Trump administration couldn't control, of course, is development of the vaccine. That was the scientists. But one of the things that we heard from President Trump all this last year, was that once the vaccine is ready, the distribution channels are ready to go. Was that not the case?
It was not the case. Now, you know, we got a late start in actually doing some of the planning. Clearly, the fact that we had a vaccine, the first vaccine out of the box, required ultra cold storage, and we probably should have started our planning in late spring. And then we would have been able to rapidly put these systems in place. I think the other thing we didn't do was give state and local governments the money. As you know, Congress was very late in appropriating the funds to try to put this in place. So we're way behind the curve.
Could we very soon see an additional vaccine in distribution, AstraZeneca, for example, that doesn't require that type of cold storage?
Yes, we have a couple other additional vaccines, the AstraZeneca vaccine, the Johnson & Johnson vaccine, that hopefully we'll be getting early in the year. And that will help us because one shot in one case and in both cases don't require the ultra cold storage.
How concerned should people be about the various strains that we're seeing from the UK, from South Africa? They're reportedly more contagious, but don't necessarily cause more disease. But many want to know if the current vaccines will protect them against those strains.
Interestingly enough, we should always be concerned when we see viruses mutate, but they do this all the time. And at least the current evidence is that the current vaccines will work. And even though these viruses seem to be more infectious, the wearing a mask, washing your hands, and keeping your distance is still an effective strategy to keep one person from infecting another.
Your group represents healthcare workers in America, but a growing number of healthcare workers are refusing shots. What are you hearing about that? Why is that, and how concerned are you about that?
Well, we're definitely concerned about that hesitancy, but it seems to be that people will eventually get their shots. They just don't want to be first in line. So what we're seeing in many parts of the country is an increasing amount of healthcare providers, once they see that the shot is safe and effective, are now willing to get their vaccinations.
Different states are employing different rollout plans. Florida's governor, Republican, has criticized New York's Democratic governor, saying his state's approach is better. Talk about some of the differences and what appears to be the politicizing of the process.
Yeah, we don't really have a place for politicizing it, and I think I would encourage all of our leaders, in fact, all of us, to stop pointing fingers. I think the biggest differences are in the priority setting and the mechanisms that they're using. This is an all-hands-on-deck approach. And what we really need to do is focus on ending the pandemic and leave the politics someplace else.